Let's answer our question for today for our Work It Out Wednesday. The question says, Mr. Smith is a 45-year-old male who is being seen for a follow-up appointment. His blood pressure is 128/82. The nurse practitioner discusses lifestyle modifications with him and has him return for a follow-up. At the next follow-up appointment, his blood pressure is even more elevated at 142/92. He has a past medical history of hyperlipidemia and is otherwise healthy. What would be the nurse practitioner's next best action? So, we read the stem of the question first, being what would be the nurse practitioner's next best action, letting us know that we got to figure out what we need to do next, basically. So if we look back at the scenario, remembering that the new ACC and AHA guidelines tell us if patients have comorbidities, then you want their blood pressure to be no greater than 130/90. And those who are healthy people, you want their blood pressure to be no greater than 140/90. So in this scenario, he does have comorbidities as he has a history of hyperlipidemia and his blood pressure is 142/92. So you want to initiate therapy. In this state, first-line therapy is thiazide. So you want to go with the answer B with initiating HCTZ, hydrochlorothiazide, and have the patient follow up in 4 weeks. Okay. I know previously with JNC8, there were a few other things, but we still treat with thiazides first. But we also look to see, their age, their race, and what type of comorbidities. We still treat similarly, but we don't look at the age anymore. With ACC and AHA guidelines, you solely look at if they have comorbidities and if they are at their goal range. If they are exceeding the goal range and their blood pressure is more elevated, then you want to treat with that medication immediately. So at that time, we've already done lifestyle modification when he was just pre-hypertensive, but when he returned for follow-up and his blood pressure was 142/92, you want to proceed with the thiazide.